The science is showing that the vaccinations work, that masks work, doing these preventative things, doing something like the monoclonal antibody treatment that we just talked about early on in a diagnosis to prevent severe illness.
Hello and welcome to Senior Life Publications Ask the Expert podcast, where we talk about all things involving healthcare, finances, free resources, and other important senior-related topics. Hi, I'm David Moss, publisher of Senior Life Publications, which is a free resource you can find throughout the Tampa Bay market.
Hi, and I'm Stephen Halstead, Senior Sales Manager for Senior Life Publications. Good to be back. We are back into what we call home, actually. So if you've watched our podcast on a regular basis, you have seen our today's guests more than once. So we're back here at Optum Primary Care in Pasadena with Dr. Hiltz. Welcome.
Thank you. Thank you for having me again.
Yeah, I mean, like I said, we're home.
Yeah, we're on a roll. Dr. Hiltz has
we're on a roll.
Always gracious enough to have us here.
So a lot of people do know who you are because they watch, but there's some new watchers. Some people checking it out today. Let them know who you are.
Sure. My name is Dr. Derek Hiltz. I am at Optum Pasadena in Pasadena, Florida. We're a primary care office. We specialize in care for seniors.
So I'm going to talk about the white elephant in the room that we've kind of not talked about for a couple of months.
For a little bit, yeah.
But I wanted to talk to you about, I was on Facebook and I read some information, or maybe some other social media, and I'm reading information about COVID and different vaccinations and treatments and things like that. And I do know that there's good information out there, and I want people to be able to get the right information. So I wondered if you could speak to that a little bit.
Absolutely, I'd be happy to. That's probably the most common thing that I'm hearing right now from my patients is questions about, the condition itself, treatment options, what are all the things that it entails. The first thing that I caution everybody about is make sure you know your source. Using social media for your primary source of information about this virus is not the greatest thing. I always say verify it. So let's say you go on a social media platform, let's just use Facebook since you mentioned that before, and it says something that the CDC says. Well, I say go right to the CDC website. People can alter things and they do a really good job of making something look official when it's not. Most people see emails that come from an official looking source that is definitely, they're looking for your information. People do that a lot with this virus. Unfortunately, we're having a lot of misinformation, disinformation from sources that look authentic. So make sure to verify where you're getting your information from, number one. Number two, we know that masks work. We're all three wearing masks. For a while, we were relaxed a little bit more in our use of masks, certainly not in the medical field, but out in the general public. I'm recommending to all my patients to wear a mask if you are going to be inside or going to be within 6 feet of people, or if you're in a position where you can't guarantee that you're going to have some space. Right. So when you go to the grocery store, when you go to the hardware store, I'm recommending my patients wear masks. We know they work. I'm around patients with COVID on a frequent basis. I have not contracted the virus. I wear a mask. My patients wear masks, so we know that they work. The other recommendation we're certainly making is for people to get vaccinated. A large majority of my patients have had both vaccinations, but there are some people who have not been vaccinated yet, so we're still strongly recommending that. Another question we hear a lot is about these booster shots. There's actually two different entities to that. There is a third COVID vaccination with either Moderna or Pfizer, and those are for people who have immune system problems, some people with certain types of cancers, certain medical conditions. So I recommend that people ask their doctor if they are a candidate for the third shot. Now, that third shot is not the booster. That's very important to remember. That third shot is actually an additional vaccination for someone who happens to be compromised with their immune system. If I was going to get this shot, I would need a booster shot, which is not available at the present time as we talk right now.
It's a lot of information.
There's a lot of information. So what I'm telling people is, so let's say we contact someone, we say, you have this, you need to get your next vaccination. Whenever they call to schedule, they go to Publix or CVS or Walgreens or one of these places, they need to make sure to tell the place they need their third vaccination.
Right.
If you ask for a booster right now, that has not been approved
They'll
yet.
shoot you down.
They will shoot you down, correct.
So you bring up several points there, but one point I want to bring up is that a lot of people will say, my uncle said, that he got, or his wife got, and da 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 da. It's not that your uncle is trying to spread misinformation necessarily. You want to trust your family members. It could be a friend of a friend of a friend. But that's where I think that the lines start to get blurred, is like, okay, yeah, one of my best friends or family member can tell me what their experience was, but I still have to be self-aware enough to know what's going on and not basing it just on what other people are talking about, because it's different.
Correct.
For each person, right?
Yeah, it is. And, a very healthy, a 45-year-old and a very healthy 45-year-old, they can have very different experiences, with any health condition, but certainly with COVID-19, we're seeing dramatically different outcomes from people. And even with the same vaccination status, two unvaccinated people can have, if you look at them on paper, they are identical. And one person's experience is dramatically and vastly different. One person has cold symptoms, the other person ends up in the intensive care unit ventilated.
Right.
One person's, as you said, my uncle, my neighbor, my friend, so people that you trust and love,
correct,
may give you this information. That doesn't necessarily mean that's the right information for you. It was just, as you said, it was their experience.
We have to be careful.
Well, can you also talk a little bit, Dr. Hiltz, about some other alternative, like the monoclonal antibody treatment? We've been hearing a lot about that too. Do you mind touching base with that?
Yeah, absolutely. So the more recent recommendations are for this monoclonal antibody. Once someone gets diagnosed with COVID-19, they actually, the state of Florida, through the Department of Health, makes that available to the public, and they don't need a referral, they don't need a prescription. They can actually either go online or call. That is through floridahealth.gov or floridahealthcovid19.gov. You can go right on there. There's a patient portal. Much like in the initial phase, whenever people were registering for vaccinations, you can actually register to get the treatment. I personally had a patient that we gave the information to. They called them. They said, walk in. Walk-ins are okay. They waited less than 30 minutes at a local facility and got the treatment. And what the data is suggesting is these monoclonal antibody treatments, even if people do not have severe symptoms, they're recommending the treatment early because it prevents severe symptoms, it prevents severe illness, it prevents hospitalizations, and then severe illness once being hospitalized, such as being on a ventilator and requiring, weeks and weeks of treatment in the hospital. So we are recommending to our patients if they get a positive test.
And that's different than what I was even understanding. I've heard, you only get the antibody if you're super, super sick. And I thought, well, how do you go get it if you're super, super sick?
Right.
Or if you're in the hospital? But that makes more sense. And so that I don't need that, but I need to be aware of that.
Yeah, it's important, and not only is the state doing it, but also emergency rooms are providing these monoclonal antibody treatments, but the emergency rooms have a different criteria than the state. So the state has put positive COVID, you get it. Emergency room, you have to meet X and Y criteria. And then you're in the emergency room around other people with other illnesses. So, again, we're trying to minimize people's exposure. The first time someone has a positive COVID test, we don't say, go to the emergency room and seek out this treatment. That's the last thing we want to do, just because our healthcare system is so burdened right now. I mean, we hear stories all the time of long waits and, just difficulty accessing care. So we don't want to just jump to the emergency room as our first level of treatment unless someone is actually sick enough to need it.
Well, definitely the preventative care. That's what obviously you want to make sure that they go for. But can you tell a little bit more about Dr. Hiltz, some of the statistics that you've come across, or some of the things that, we ended up kind of talking about this a little before, and what hit me was some of the numbers that you were just throwing out there. It just kind of took me back in shock. Do you mind telling some of our viewers
Absolutely.
Some of those numbers?
Happy to. Yeah, so what we're seeing with the vaccine is that vaccinated, people who are fully vaccinated, so have had both doses of the vaccination, they are about 10% or less of the hospitalizations and serious illness. So 90%, 9 out of every 10 people who are hospitalized with serious illness, and serious illness means could require ventilation. Some of these really, really big things could requiring steroids and all these things, and oxygen. That's 9 out of every 10 people in the state of Florida right now. And generally throughout the nation, but just specifically in the state of Florida, 9 out of every 10 people hospitalized and with serious illness are unvaccinated. So there is a chance that people that are vaccinated can get sick, but we're talking a 10% versus a 90% of,
Right.
of the burden that we're seeing. The other interesting thing, this is another thing that I get a lot of questions about, patients who have had a COVID diagnosis previously. So they got the test, they had COVID, in the earlier portion of this.
Before the vaccine.
They recovered, they're doing well. Do they need to get vaccinated? And the most recent data from the CDC suggests that they do. They did some testing and they were trying to determine the body's immune response. And they checked someone's immune response who had COVID. They checked someone's immune response with a single vaccination and then when they were fully vaccinated. And the results were dramatic. Each phase of the single vaccination and the double vaccination, how much more immune response your body has. So you have some immune response from developing the actual getting the virus, and then the first vaccination and the second vaccination just exponentially improves your body's ability to fight this off. So they're again reducing serious illness and also reducing the chance of getting it for a second time. The fully vaccinated people who had COVID once, their chances of even getting the virus a second time were dramatically reduced.
And I know several people who's had it multiple times prior to the vaccine. So they were unvaccinated. I'm not talking about now, so I don't know. I think it's interesting. Where are we as like the Tampa Bay, Hillsborough, Pinellas, Pasco? Like, how are we handling number-wise? How are we handling the virus?
Unfortunately, not great. We're certainly not the worst in the state. We're not the best in the state. We're in the kind of the upper third of not as good control as we like. We're still seeing a large number of unvaccinated patients, unfortunately, and that is contributing to our increased hospitalizations, increased ventilators, increased intensive care unit, occupancy. So we're still up in the upper level of, that saturation point where it is still difficult for people without COVID to be able to find, care in some instances. So, we're certainly not where we need to be. We still have a large percentage of our population who qualify, who would be good candidates for the vaccine, who are not. People are trying to get back to normal. If you see sporting events are open back now, college football, professional football, more and more concerts. And while a lot of these things are occurring outside, people are still in a small, confined, relatively confined space. And so, that even is more of an impetus to get people vaccinated to make sure that they're protected for themselves as well as the people that are surrounding them in these, in these areas that you can't space away from.
And you don't know.
Right.
I mean,
Is there anything you want to actually add? Anything? I mean, the information you just given us is just been
amazing.
Fantastic. Where do you foresee, with the Delta variant, it seems like, say, this variant, it just keeps sort of either morphing into something else. It's hard to kind of predict where we might be. But you feel like you're a little bit more comfortable that science is starting to kind of get a hold of this a little bit more, maybe a little reassuring?
Well, it's challenging because, this variant changes, the virus mutates, as all viruses do. The cold virus, the flu virus, all these viruses mutate. And so, we are getting a grasp, or a better grasp, I should say, on the overall picture of COVID-19. But there's this variant, there inevitably will be another variant. But we know for sure the science is showing that the vaccinations work, that masks work, doing these preventative things, doing something like the monoclonal antibody treatment that we just talked about early on in a diagnosis to prevent severe illness. And we really can wrap our hands around this and get it under control, but it's going to take everybody around us, being vaccinated, being cautious, wearing masks, choosing to keep their distance, people with symptoms to be aware that they have symptoms and not, I don't want to miss, my dad's birthday. Those type of behaviors really being not only thinking about ourselves, but thinking about the people that are around us. And I think once that occurs on a little more widespread basis, we'll be in a lot better position to be protected and hopefully get back to whatever our new normal will be.
Right. Well, thank you very much.
Absolutely.
It's good to talk about it and listen to the data behind the science a little bit. So I wanted to let you guys know that Optum is hosting a webinar that's going to be online, virtual, at no cost, and it's a Caring for Elderly Parents. It's going to be on Wednesday, September 22nd from 11 a.m. to 12 p.m. and Thursday, September 23rd from 5:30 to 6:30 p.m. And you can RSVP for that seminar by calling 866-721-3169.
And thank you, Dr. Hiltz. It's always a pleasure to see you again. Thank you so much for giving this great information. We've really been holding out and giving a good talk about COVID to kind of see where it's going on and progressing on down the road. And thank you so much for joining us too as well. If you'd like a free subscription to Senior Life Publications mailed to you, please contact me. My name is David Moss. I'm the publisher of Senior Life Publications. My phone number is 727-430-5180, or you can email me at dmoss@seniorlifepublications.com. And don't forget to watch this video, hit the subscribe button, and ring that bell to be notified of any upcoming podcast in the future. Thank you so much and have a great day.
Bye, guys.